Over 1 million people on Medicare Advantage are losing their coverage in 2026. So if you're on one of these plans, don't just assume that it will automatically renew. Stick with me till the end so you know exactly what to do next. Right now, nearly 69 million people are on Medicare, and 54% of them, more than 37 million people, have a Medicare Advantage plan. I'm going to walk you through exactly what's happening with Medicare Advantage plans in 2026, why it's happening, and most importantly, what your options are so you can make the best decision for you before the December 31st enrollment deadline. And yes, I totally meant to say December 31st, and we'll get to the why a little later in the video. So let's start with the facts about what's changing. UnitedHealthcare, which is the largest Medicare Advantage provider in the country, said in July that they're dropping plans that cover over 600,000 people. And they're not alone. Humana expects to lose about 550,000 Medicare Advantage members this year because they're leaving unprofitable counties and dropping unprofitable plans. These insurance companies aren't leaving Medicare Advantage altogether, but they're dropping a bunch of plans. And a lot of insurance companies, not just these two across the country, are also dropping hundreds of plans for 2026. Add it all up, and we're talking about over 1 million people who will lose their current plan and need to find a new one. Now, it's really important to understand how insurance companies work here, because even though the insurance companies would probably love to be able to do an automatic transfer, if your current plan is canceled, they will not automatically move you from your old plan to a new one. You have to take action and change to a new plan to make sure that you stay covered. If your plan is canceled and you do nothing, you'll only have original Medicare, no Advantage plan benefits, and no prescription drug coverage. So you might be wondering, why are so many insurance companies suddenly dropping Medicare Advantage plans? Well, Medicare Advantage plans replace traditional Medicare. So instead of the government managing your healthcare, a private insurance company does. And these plans usually include extras like prescription drug coverage and dental and vision and hearing and many other perks. They give more than regular Medicare, but not for free, and definitely not because they care about you. And I think there are three main reasons insurance companies are pulling back from Medicare Advantage, and they all relate to costs. First is healthcare costs are rising faster than inflation, especially for outpatient care. People on Medicare are also using their benefits more than expected, which costs the insurance companies more money. And third, new laws from the Inflation Reduction Act shifted more of the prescription drug costs to insurance companies, and these changes took effect in 2025, and more changes continue to come in 2026. Remember, insurance companies get paid by the government to cover your health care. In 2025, they even got an extra $2,255 per person. They have to spend most of that money, at least 85% of it, on actual medical care. That leaves only 15% as a safety buffer, and when costs go up or people use more care, that buffer can disappear fast. And unlike other businesses, insurance companies can't raise prices throughout the year. Their rates are set for the whole year, so if costs end up higher than expected, the only thing they can do is cancel plans that aren't making money for the next year. And even if your Medicare Advantage plan isn't being canceled, you might see changes as insurance companies try to control those costs. And here are some changes to look out for in your annual notice of change letter. You may need a referral from your primary doctor to see specialists. Your doctor may need to be a part of a specific network, since some insurance companies have formed partnerships with specific hospital systems. Copays for specialists might go up, dental or vision coverage may be reduced, or extras like gym memberships and over-the-counter cards may be removed from plans. Free plans might start charging a monthly premium, or current premiums could go up, and deductibles might even be added for services that didn't have them before. Now let's talk about your options. You have two main paths to choose from, and the deadlines are different depending on your situation. Option 1 is to choose a different Medicare Advantage plan. If your plan is continuing but changing benefits, you have from October 15th through December 7th to make changes, and any changes you make will start on January 1st. But if your plan is being canceled, you get more time, and you have until December 31st to pick a new Advantage plan that will start January 1st. Option 2 is to switch to original Medicare with a Medigap plan. If your Advantage plan is canceled, you get guaranteed issue rights. You can buy a Medigap plan without health questions or medical underwriting, even with pre-existing conditions. This is really nice because normally switching from a Medicare Advantage to Medigap plan requires passing a health check, but not under these rights. Under guaranteed issue rights, you can pick from Medigap plans A, B, C, D, F, or G. Plan N is not included in this guarantee, so picking Plan N still requires answering health questions. If you were eligible for Medicare before January 1st of 2020, you'll likely need Plan F, though some states allow switching later. Your window to sign up starts 60 days before your current plan ends, so November 1st for plans ending December 31st, and that goes for 63 days after, so into early March. However, if you want to avoid any gaps in coverage, enroll by December 31st for a January 1st start date. Here's what you need to do to prepare for all of these changes, and I recommend starting this process sooner rather than later instead of waiting until the last minute. First, read all mail from your insurance company. Your annual notice of change letter comes in September, and if your plan is canceled, you'll get extra letters. These documents contain very important information about your options. Second, if you work with an insurance agent or broker, talk to your insurance agent after October 1st. That's when agents can start discussing next year's plans, and you can't enroll until October 15th. Third, check your doctors. Make sure your doctors and other providers are in the network of any plan that you're considering. Even if you're thinking of switching to a similar plan within the same insurance company, your provider network may be different, so please pay attention to that. And fourth, if you're switching to original Medicare with a supplement plan, remember that you'll need a separate Part D plan for prescription drugs, since Medigap plans don't include prescription drug coverage. And depending on your needs, you might need to get a separate dental and vision plan. So definitely take all that into consideration for the costs. These changes to Medicare Advantage are big, and your choices now affect your coverage and costs for all of 2026. The most important thing you can do is start planning now. Review your current plan, think about your healthcare needs, and know your options before enrollment opens on October 15th. I'm Callie Navrides, a licensed insurance broker and certified Medicare expert. If you want help reviewing your plan or exploring your options for 2026, you can reach me directly or schedule an appointment. My info is in the description below. And if you have any questions about your plan or these Medicare changes, leave them in the comments. I read and respond to every single one, and I'll even answer them in a future video to help more people just like you. And after that, click right here to check out my next video with more expert Medicare tips like this. Thanks so much for watching, and I'll see y'all in the next video.